Let's continue with visual diagnosis, inspection, still on the lips. Now we'll talk about lip bearing. This is defined as the so-called state of the lips. It refers to the movement and relaxed state of the lips. Normal lips should open and close flexibly and voluntarily without deviation or twitching, tightness, or drooling. The lips are relaxed and flexible. It's clinically significant as the bearing of the lips can help identify the pathogens and reflect the conditions of the Zhangfu organs. For its pathomechanism, the bearing of the lips is dependent upon the muscles and sinews. When the muscles around the mouth are flaccid, it can lead to a drooping mouth, drooling, or a mouth that cannot close. The sinews and muscles around the mouth spasm due to malnutrition or a pathogenic attack of wind. There could be tightness, locked jaw, twitching, or deviation of the mouth. So here we have an illustration of the pathomechanism of lip bearing. So if we have the internal Zhangfu, there is deficiency in the internal Zhangfu organs, it will result to muscle or tendon spasm or flaccidity. The same if there is also an exogenous pathogenic attack. So muscle or tendon spasm and flaccidity will result to three conditions. First, we have a deficiency, which can be manifested in flaccid muscles. So in open mouth, we have an open mouth, a drooping mouth, and drooling. Another condition is excess. This manifests in spastic muscles. So this is a closed mouth. In closed mouth, we have tight mouth and locked jaw. Another condition is wind. This will manifest with spastic tendons. So in bearing, we have twitching mouth and deviated mouth. So the pathological changes of bearing and their indication. So we have tight mouth. Here, the lips are rigid and spastic, causing tightly pouting closed lips which impede the ability to eat and drink. So if it's usually seen in neonatal patients, tight mouth with spasms or limbs and opisthotonus, this is an indication of excess wind, as in umbilicus wind. If it's usually seen in the late stages of a critical condition with tight mouth and cold limbs, it's a deficiency wind condition. Next, we have locked jaw. This means the mouth and teeth close tightly and cannot open. So if it's locked jaw, opisthotonus, lip spasms, chills, and fever, this indicates exterior wind toxin, as in tetanus. If it's usually associated with high fever, there is limb spasms, and may be accompanied by dysentery, it is an indication of wind due to excess heat. If it comes with hemiplegia and coma in some cases, it's an indication of wind stroke. If it is a sudden attack with twisted limbs and recovers after a few minutes, it's an indication of wind phlegm, like what happens in epilepsy. If it's a neonatal patient with bluish face color and cold body, this is an excess cold condition. Next, we have deviated mouth. This means the mouth is twisted to one side, usually accompanied by the deviation of the eye. So if mouth or eyes twisted to one side, usually with no other symptoms, this is an indication of wind attack in the collaterals. If there is sudden loss of consciousness, deviated eyes, mouth or tongue, and there is hemiplegia. This is an indication of wind stroke. If there is deviated mouth and eye, a burning pain, an earache accompanied by headache, bitter taste in the mouth, and red face, this is an indication of heat toxin injuring the collaterals. Next, we have open mouth. So this means the mouth remains open and cannot close. So first we have a patient's mouth, which remains open with high fever, red face, thirst, and canker sore. This is an indication of excess heat. If the mouth, if there is open mouth breathing, there's shortness of breath, and cough with foamy sputum, this is an indication of lung deficiency with phlegm stagnation. If it's a sudden attack, open mouth, drooling with mucus and loss of consciousness, it's with phlegm, like what happens in epilepsy. Next, we have a lip droop, which means the lip hangs down and cannot close. First, we have drooping lips, fatigue, pale tongue with white coating. It's an indication of the middle teeth sinking. If the lips droop or excessive flaccidity, usually occurring after chronic diarrhea or dysentery, there is cold limbs and low back pain. It's an indication of spleen and kidney yang deficiency. Next, we have lip twitching. This means the lips tremble, twitch, or shake involuntarily. If the lips shake or tremble, there is pale lips, face, tongue, and weak pulse. There is spleen qi deficiency. If there is lip twitching or shaking, the lips are pale and the nails are also pale and the pulse is thin. This is an indication of wind due to blood deficiency. Next, we have involuntary drooling. Here we have a copious saliva, mucus in the corner of the mouth, or drooling. So if there is involuntary drooling, profuse watery saliva aggravated with cold, this is an indication of spleen deficiency. If there is profuse saliva in the mouth with occasional drooling, cough with foamy sputum and a pale tongue, this is an indication of lung deficiency with cold. This case is mostly seen in children. There is involuntary drooling, red lips and tongue, and possible canker sores. This is an indication of spleen heat. If there is a deviated mouth and tongue, drooling, and hemiplegia, this is an indication of wind stroke. If it comes in sudden attack, drooling, and loss of consciousness, there is wind phlegm, as in the case of epilepsy. So to summarize, lip color manifests the condition of the blood or pathogens. So whether it's heat, cold, and others that may affect the blood circulation. So the color pathogenic changes will manifest with pale lips in qi and blood deficiency, red lips in heat condition, deep red in heat toxin, purple lips in blood stagnation, and black lips in extreme stagnation or heat. Next, we have lip shape, which manifests the condition of the body fluids and the nature of the pathogenic factors. So in its pathological changes, if there is swollen lips, it indicates toxic heat. If the lips are eroded, it indicates heat. If the lips are pale, it indicates dryness. And if the lips are chapped and dry, it also indicates dryness. Next, we have here the lip bearing, which indicates the condition or which reflects the condition of the muscles and its etiology in the harmful organ condition. So here we have an open mouth. If the mouth are open or cannot close, there is an excess heat. If the mouth is drooping, it's a deficiency condition. And if there is drooling, it's spleen deficiency or wind stroke. Next, we have closed mouth. As first, we have tight mouth if there is wind, and there is locked throat when there is wind. In mouth bearing, we have twitching mouth in deficiency condition and deviated mouth in which indicates wind. Thank you for your attention.